This episode contains references to some topics that may be challenging for listeners, including self-harm, suicide, and mental illness. Please listen at your own discretion. If you or someone you know is struggling, free confidential help is available 24/7 by calling or texting 988. Welcome to Brilliant in 20, a podcast from Emerald One, where we celebrate the unique brilliance of today's leaders and share their experiences with you in just 20 minutes.
Welcome to Brilliant in 20, a podcast from Emerald One where we celebrate the unique brilliance of today's leaders and share their greatest lessons with you in just about 20 minutes. I'm Kai Miller. Today, we're sharing another special edition of our podcast to recognize National Suicide Prevention Month. Suicide and mental health are deeply personal topics for many of us, and they have far-reaching emotional, physical, and economic impacts. With me today is Janae Sharp, founder of the Sharp Index, a nonprofit dedicated to reducing physician suicide and burnout. Janae and her team create human-centered, data-backed tools and interventions to address the complex issues at the source, improving the quality of life for healthcare providers. Through their observations and advocacy, the Sharp Index also promotes mental health research, provides tools to help transform healthcare systems, supports community building initiatives, and amplifies physicians' voices to raise awareness. Janae, thank you so much for joining Brilliant in 20 today.
Thank you so much for having me. I'm thrilled to talk about our work and to talk to you too.
I am very excited to hear about it, and we genuinely appreciate it. So give us a little bit of an overview. What is the Sharp Index?
The Sharp Index is a nonprofit, and we are dedicated to improving physician and clinician mental health and preventing suicide. Healthcare workers have more workplace violence and are more likely to die by suicide than other groups. And my former husband died by suicide before finishing his residency. And at the time, it was really overwhelming for our kids. And I didn't feel like the people that I knew and even the school responded in a great way. It's like they didn't know what to say. So I decided to start a nonprofit a few years later, and here we are. That was in 2018.
Wow. So what does the Sharp Index provide for healthcare professionals?
That's a great question. I'm glad you asked it. So a lot is the answer. It's a pretty big nonprofit. We have some tools that are checking in on your state, checking in on mental health versus burnout. We also have direct support and scholarships that we've done for people and advocacy work, as well as working with healthcare systems to create a healthier structure. Because we decided to start with what we were good at, which is a lot of the founders, they're CMIOs, which for people who don't know that's people who are great at informatics. And me, I've had a background with healthcare IT. So we got all the geeks together and started there. So some of the things we can provide are, a visualization of people's behavior, or something like a survey for people who are doing great and people who aren't. And I think there needs to be a combination of direct input from clinicians that you're working with and, you looking at and collecting data on your end.
So you have kind of a blend of those two things at the Sharp Index, where you're able to give the organizations a view of maybe how their employee base is doing overall, as well as provide some ways of adjusting if they're not doing as well overall. Am I hearing that correctly? Okay.
That's right. Yeah, it's interesting to talk to people about it too, because they'll tell us something that you wouldn't necessarily tell your employer. I don't know if you've ever worked for a place that has like a survey or they ask you and you're like, things are great. My boss is reading this.
Yes. Yeah.
So in healthcare, the stigma for having an issue might even be higher. Um, so it's important that some of those reporting systems and some of those methods of collecting data are something that you know are anonymous. So we're glad to partner with people in kind of like a third party way.
Yeah, being that kind of safer third party space to go to.
Right.
I love that you described that you got the geeks together and then you just solved some problems as geeks too. So
Yeah.
that's amazing. You said you started the Sharp Index in 2018. So the obvious question that leads to is we then hit 2020, which is one of the most significant times of crisis for our healthcare system. What are some of the things that you at the Sharp Index observed during that time, or some of the advancements that you had within the organization too?
That's a great question. During the pandemic and during that era when people were in more crisis, I observed a few things that I think we should talk about today. Um, One, people were more likely to accept help. Before, when we would talk to people, they might have high levels of burnout or even high levels of depression, but they did not have a high willingness to participate in any solution.
Mhm.
So the willingness to be open about how hard it was drastically changed. And for us, that was a great thing. The levels of personal distress also skyrocketed. And what we found was that initially, that meant levels of burnout decreased. Because when there's a crisis, we have a physiological response. We step up to it, especially people who are trained for that and people in healthcare. They really stepped up and did more. But the sustained problem created massive need.
Yeah.
People, you can only sustain that level of crisis for so long before you just quit.
Yeah.
So we noticed that. I also noticed that the way that people outside of healthcare talk about healthcare, mental health, and providers was so much more human. And that was a huge change that I thought was super important. Just the depictions of healthcare providers and physicians that we've lost was so much more positive. I will
When you
also
say, sorry, go ahead.
go ahead. Oh, sorry. No, I was going to change it. So if you have a question, I was going
I
to move
was,
on to the next thing I noticed.
yeah, I
The
was just
last.
going to ask, that's an interesting observation that you had. So prior to that time, you shared that they started to refer to healthcare professionals more as human. So
Yes.
prior to that, was it in sort of this heroic or pedestal kind of way, or how was it before? What was the shift that you saw?
I feel like we still referred to them as heroes, like literally.
Yeah.
But before that, I think we were dealing with this human thing where we compete for resources. And when we're talking about like supporting people, usually we want to support the people who need the most. And that's not always going to be physicians or nurses. They're not the saddest.
Yeah.
So people would have that pushback where they'd be like, well, I probably should be supporting someone else. And these guys are just whining. They make enough money that they can
Gotcha.
just get over it.
Yeah. Yeah.
Um, Without fully understanding the importance that has for us or for patients or even what that means. And they blamed physicians and nurses more than during the pandemic. You know, there is a
Yeah.
danger in calling people heroes because you have a high expectation for heroes. Like if Hercules lets you down, that's a big letdown.
A little
But you
bit of a
did,
problem.
yeah, you did expect perfection. So I thought it was a positive move that we're moving more towards seeing healthcare providers, physicians, and nurses as humans that we're working together with. So that was hugely popular. No, that was hugely positive.
Yeah.
Also, I will say we noticed a huge need specifically for childcare and for support for physicians or nurses that had families. during that time. We expanded the nonprofit to work with all healthcare professionals at that time, and we provided a lot of direct aid for people who might not have childcare. They work irregular hours, and the people who were most negatively impacted were people who were early in their career or in their training or
Right.
had a lot of need. And during the pandemic, I think it was about a year ago, I started noticing that every single parent that we talked to, because we talked to people in crisis, their children were also in crisis. And it was
Yeah.
staggering to realize how poorly people were doing. Um, so while our perceptions and our willingness to get help has seen huge improvements, like the need has also skyrocketed. And somewhat, now we're facing kind of that post-pandemic. People are a little bit over it,
Yeah.
you know.
Yep.
People are they're a little bit tired. Um, so some of those challenges remain.
So let's talk a little bit about, I find it so interesting that you are able to be having direct conversation with some of the healthcare providers, as well as gathering data and the quantitative side. So you have this really great blend of the qualitative stories that you're hearing directly from people and some quantitative data to back that up that may help you have a little bit of a better image of what distress looks like and what burnout might look like. So, distress is something that can look very different on every person. Have you identified some key indicators that someone is in distress that leaders may be able to use as they're working with their employees or their teams?
Yes. And this is something anyone could do with their existing data and with their IT team. Um, there are a few things that you can look at. I don't know if you mean like generally program level or in your electronic health records, because there are different ways to approach
Yeah,
it.
yeah,
A really simple way to look at this to identify distress is to look for changes in behavior. If you have someone who's been really consistent and they have a drastic change in their behavior, that's something you need to look at.
okay.
Another thing that people need to address is volume of work. And how you address that can be, you can approach that from many angles. You could look at how much people are working in hours. You can look at your scheduling. You can look at how often someone is getting sick and you're
Yeah,
having that. So understanding people's workloads is critical. Because if you looked at it, especially over the past few years, we've had a lot of turnover in some aspects of healthcare, and that longevity matters, and understanding the organization makes you more effective at your job. But just looking at something like how many hours did this person work doing actual work, not just your scheduled work?
yeah,
How many hours are they working during the day? And you can track that, sometimes in the electronic health records, you can see, are they working after hours? Are they doing extra shifts? And you could ask them if they're working other places. Understanding how much people are working is one of the easiest, but people don't always think of it, is the easiest ways to track distress.
yeah.
Because we found with asking people, there's kind of an inflection point. And once you've reached that inflection point, those people won't engage with you. They're probably going to quit. They're high stress, high burnout, and high work. Now, when those changes happen, they aren't willing to engage. But the people that you really can help, the changes in their behavior start before that on the curve. They'll start missing more, or they'll have erratic behavior or a change in behavior. Or maybe they just need more support with the way your healthcare system delivers care. So that's what I would say is the most important thing. Look for any change in behavior.
Yeah, so that's kind of your first line indicator,
Yeah,
and it gives you the cue to be having the conversations, the
right.
interactions with people. What do you say to leaders in an organization when they say, that's so much time for me to notice changes in behaviors I have this huge staff in my healthcare system. What are some of the ways that leaders can be looking to embrace that level of regular familiarity with their employees' routines, their behaviors, the things that are normal, so that they can then see the changes?
That's a great question. And I tell people the same thing I tell my kids. Start with what you can do. Start with what you know.
Great advice. Yeah.
Before you do anything. And start with the tools you have. Because people might not realize this, but their electronic health record, chances are, has a way to track this. Or their team leaders probably know who needs help. So start with what's easy. Start with what you know. Most systems have a method of tracking either behavior or attrition. They just, and it's really a simple report.
Yeah.
You call the guys, they do it, it takes an hour.
Yeah.
You just might not know it exists. And
You might
that's
not know how to
why,
get to it.
yeah, that's why you think it's a lot of work, because it's actually not.
Yeah. Or it sounds like it's a simple conversation with the team leaders and adding that extra question every week. How's everyone doing?
Right.
Does anyone need help on the team? And it might cue those middle managers, the team leaders, into paying attention to those things as well, so that it goes on.
Right.
So healthcare is an incredibly complex environment. We've talked about burnout being high there. Pressure seems to, while people are over COVID and the pandemic, talk of the pandemic, we also have had a lot of attrition in healthcare. So people are doing more with less in the healthcare system. So what are some critical changes that you and your team are noticing are necessary to create or build healthier work environments? How do you maintain the level of good mental health when you may not have tons of resources to do that?
That's a great question. Because I've seen people do it in different ways. And some of it hasn't gone so well. Obviously, people are leaving healthcare. And I don't think we would have heard from the Surgeon General that healthcare workers are in crisis if they were doing well.
Yeah.
In terms of building a healthy system, I think it's important to build it together with the people who are involved. And that's not just your healthcare team. That's not just your nurses and your healthcare workers. It's also with your community. Some of the most successful hospital systems in terms of attrition, they have strong ties in the community, whether that be through service that they've done or through education. So one of the most helpful things that healthcare systems and leaders can do is to get more involved with their local community and local leaders. Also ask the people who work for you. They said that really slow because that is something that people really struggle with.
Yes.
They really care.
Where do you notice the struggle happening with that?
I think a few things are there. I just think some people do not care. And we need to really acknowledge that. People aren't going to break down a system where they won. You're not going to criticize the game you win at every time. So sometimes the people in the most power, the leaders, they're like, well, it was okay for me. So it's really hard for them to accept how things are now.
Yeah.
So we talked a little bit about scheduling.
Yeah.
We've provided some aid and connected people with actually attorneys. And that system, I had someone come to me and say, my health system isn't being very kind to me. Like, do you have a support group for moms who have lost babies? And I'm like, that's very specific. So this physician had an order from their doctor for a certain work schedule and was getting a lot of criticism from their supervisor. And they felt like it was retaliatory. And whenever you come to that, you have a few choices. You either find a new job, you try to work through it, or you advocate for yourself. And that's uncomfortable if you're in a position where someone's critical of you.
Yeah.
And we realized after talking to them one, the leader did end up needing training and understanding for how to provide the care. I think a lot of times we assume like managers or leaders in healthcare understand what they're doing, but they might not. And two, it ended up being like a legal issue about their rights. We're not always understanding that you should have a right to a healthy workplace,
Yeah.
even in healthcare. And if you lost a child, you should have a right to grieve that time and to have support. And they actually had a scheduling tool, the health system had it, but they hadn't turned it on. So
Oh,
they could
interesting.
have written in all the rules from that doctor, whether that be for grief or for a medical release. You can write the rules into their scheduling, but they hadn't because they didn't know how to use the tool. And that was super frustrating. Like they could have provided a great experience, but they didn't understand patients' rights or employee rights either. And
Yeah.
they could have made it easy and invisible, but they didn't know how to turn it on.
And they
So,
didn't have an understanding of the tool that they already had available that would have alleviated
it
everyone's experience across the
yeah,
board.
it would have made it so much more positive and you wouldn't have had that animosity
Right.
between the manager and the employee who needs a modified schedule. I have talked to a lot of leaders who say it's difficult to follow those things. Like that's a lot of work and you have to make your technology, your tools accountable to make it less work.
Yeah. That is an excellent story about using technology to enable you to provide that supportive environment that your employees need without it being additional operational challenge, right?
Right.
So just knowing what's already available to you, like you said, start with what you can do. Look at what's already around you and use those things to make it better for everyone across the board before you go looking for something new or try to implement some complex process.
Yeah.
Yeah, thank you. I'm glad that was an excellent story. Um, I was
But it
going
was
to
a
go
sad
back.
story. It was a sad story for
It
them, but
is,
like,
it is, but it's a good story for others to learn from. I
yeah.
think I love your mantra of start with what you can do. I think that's it's an excellent point for all of us to start from. And I wanted to go back to you sharing that it's a struggle for some leaders to understand what they can do. What are some of the questions that they could be asking to better get in tune with these things? What are some of the questions that a leader could be paying attention to?
Well, there's a lot of studies about which questions are best and which ones are going to work. I advise people to start with what people love.
Mm,
Like, so write down the things that you as a leader think are the most important and great things that you are willing to try. And then ask either your team leads or employees to get that data for you. What are people excited about trying? What are people excited about making better? And you can even position it as a positive thing. You know, what have you seen that you would love to try? What do you think we need to do? And build it based on what people say. Because the success of your program isn't always based on the program. People are much more likely to have success when they do something that they picked. And that's
mm,
the single greatest indicator of if your program will succeed, if it's what people wanted to do. It could be anything. It doesn't matter. If they
yeah,
picked it, it's going to have a better support and a better outcome than if they didn't pick it.
yeah, great advice. And I think it's very useful for those of us who might be leaders and are trying to think our way around well, I set up a committee for this and the committee isn't getting things done. That committee is probably the same group of people who volunteer for nearly everything in your company.
Right?
It's
He
not
wants,
necessarily, yeah, it's not necessarily the committee, it's the opinion of the broad employee base. So I think
right.
that's a great approach to getting some feedback on making change. Um, so if
It's
you had
hard
to
though. It's hard
share,
for leaders to let that go, I think,
yeah.
especially when they're in medicine, because they've been trained to be perfectionists and like know everything. So the idea that like there's no one best way, that's a very huge challenge to a physician leader.
Oh, I can imagine. I think
Yeah,
probably for many leaders, because they typically our CEOs, our executives are highly trained, highly educated. They've solved a lot of problems in their careers, and hearing those different voices or knowing how to hear those different voices and opinions and factor them into the solution
right.
sometimes can feel just like a lot of noise coming at you to be able to portion that out. So it seems like that's one of the great values of organizations like the Sharp Index. You can kind of help see through that noise a little bit.
Yes. It's also
Yeah.
nice because we have, we're less threatening sometimes than your employer.
So if you were to, when you sit down with healthcare executives, with health system executives, if one of them were to ask you, Janae, what is the one thing I need to do to create a better environment in this organization? What is the one thing you tell those leaders?
Sometimes I just ask them what they're passionate about. You do the thing that you care about the most. The other thing I would advise them to do is rounding.
Rounding.
Yeah.
Explain a little bit.
Um, in healthcare, leaders should be walking around to see and watch patient care. They should be rounding on patients. They should be rounding on teams. They should be there where care is happening. They should call and make an appointment for themselves at their own health system. Good luck. You're going to hate that. Good luck. You know, they they should be on the front line of care, watching what it is when people have to click through 10 billion windows, watching
Yeah.
to see if their policies for scheduling actually work.
Wow.
And sometimes the horrible experiences they have just scheduling something, they're enough. If you listen, I don't know if you've heard the story. Chris Ross talks about having cancer, and he talks about how hard it was to schedule his own care as the CIO of Mayo Clinic.
Wow.
And you can't always simulate that. Like you can't give someone the understanding that lived experience has, but you can learn a lot from just going through the process. Like, what's it like to get mental health care at your health system? Go through it, try it. So that's the thing I think is critical. If you're going to succeed and build a healthy organization, you have to sometimes not just ask your committee members, not just ask your leaders, but actually be rounding.
Immerse yourself.
Yeah.
Yeah. Okay. Let's switch focus to the employee. If there's someone experiencing distress, if they're getting close to that burnout point, but they're not yet at the disconnect point, and they struggle with asking for help, what do you advise them?
There are a lot of programs that can help that have lower like barriers to entry. And we've provided help directly to people. But one of the most successful programs that we've had, this was even it before 2020 when people really started to feel like they could ask for help more. They had an easier time participating as a mentor for someone who is younger. So people who are struggling, sometimes the most effective programs are like supporting a medical student. So you teach the skills of like mental health coping, but your role is different. So you don't have
Interesting.
the same stigma. So I tell people to look for something where they're a mentor. Like if they
Wow.
really don't feel like they can just come right out and say it, because in some places they cannot. I feel like that's something that I cannot emphasize enough, it is not always safe to get help, but you can find places where it's safe to be a supporter, to be a
Yeah.
peer support, where you can get those same tools and the same education without that stigma that you might personally have or you might have at your organization. So I tell people to look for that.
Excellent advice. And I know many people will probably get a lot out of that. That's not something, the mentorship approach is not something I've heard in the past. So thank you. I appreciate it.
Thanks. And we did
Yeah.
that when we had like so many people who were unwilling to do it for themselves, but they
Yeah.
were willing to do the same program as like a helper. And I'm like,
Yeah.
well, your outcomes are improving, but you didn't have to say, look, I'm really depressed, which is the hard thing to say.
Well,
You
and when you're
know?
in a career that is so focused on helping others,
Right. It's like
sometimes
it,
that,
it's
yeah.
like in AA where they say the first step is acceptance. I am telling you, you can succeed even without accepting.
Yeah.
Like you can get better, you can get support without accepting that maybe you need help.
You need it. You need
Yeah.
you can avoid it a little bit.
Right. Yeah. It's just not as direct. Like we don't need your acceptance. We can help you anyway.
Yeah. Well, thank you, Janae. This has been incredibly educational on so many levels. I love that we've gone from healthcare systems to health IT to culture change to helping individuals. I really appreciate it. And I am hopeful that our audience looks up the Sharp Index and learns about some of the incredible things that you're doing.
Yes, thank you so much. I hope we can get involved and that
Yeah.
people realize we do a lot with data, and I was obsessed with it at first, trying to show people why it's important. And I really think in the end of the day, it's our connections and our humanity that
Yeah.
drives improvement. We're not going to make these changes because we see a great spreadsheet. We're going to make these changes because we care about each other.
Yeah, absolutely. What a wonderful note to end on.
Thank you.
Thank you so much. I appreciate you joining us.
Thank you.